My material ID is 2022961401. So today I would like to present about the breast cancer, the awareness of breast cancer for activity 5 and 6. So yeah, let's do it. 2018, 2 million women are diagnosed with a breast cancer in the next 30 years will nearly double that of everyone else, because it is the common cancer in women in almost every country, especially Malaysia. So we are doing everything in our power to protect a woman Asian from dying of breast cancer every step of the way. Next, who might be the rarest person to have a breast cancer? First, being a woman, which is the biggest risk factor for developing a breast cancer. Second, being an overweight, obese, or have unhealthy lifestyle. Third, the factor of age. The risk of having breast cancer goes up as you getting older. Commonly, breast cancer are found women in 55 years old and above. Alright guys, now I would like to share 5 steps to detecting breast cancer early. Alright, first, always practice self-exam routine. In every morning, before you taking a bus, do some self-exam routine. Alright, second, know about your risk and your background or family history, which is your mother, might be your sister or yourself also. Third, make an appointment to do some self checkup and always meet your doctor to know about your health condition. Fourth, know when to get a mammogram test, or last but not least, follow up after having a breast cancer screening. Alright, so next we move to how to prevent a breast cancer. Here I will share to you guys 5 ways to prevent a breast cancer. First thing first, always practice always practice a healthy lifestyle. Keep the healthy weight and always do exercise 3 times a week. Eat a good food. Eat well. Next, always practice self-exam routine, as I said before. Then, don't forget to have a mammogram or breast cancer screening, which is with both of tests will save your life. And most of women should get early mammogram test starting age of 40. Alright, then you should find out your family history. A doctor or genetic counselor can help you to understand your family history of the disease. Lastly, last but not least, to all women, avoid a menopause hormone therapy, because women who high in progesterone hormone who will have a high risk to having a breast cancer. So women do take a menopause therapy. It should be for the shorter time as possible. Alright, so that's all from me for activity 5. We see you in the activity 6. Bye. Breast cancer is the most common form of cancer affecting women in Malaysia. About 1 in 90 women in this country are at risk, compared to 1 in 8 in Europe and the United States. Next, how did the breast cancer affected to your body? Breast cancer occur when the cell in the lobulus, which is mid-producing gland or the duct, become abnormal and divide uncontrollably. This abnormal cell begin to invade the surrounding breast tissue and may eventually spread via blood vessel and lymphatic channel to the limb, node, lungs, bones, brain, and liver. Here, I want to give the real statistic for you to digest, which is did you know that breast cancer afflicts an estimated figure of more than 1 million women in the world each year, and is the second leading cause death among women worldwide, second to the lung cancer. And also, did you know that of the new case of female breast cancer reported in Malaysia from 2003 is 64% of these cases were women between the age of 40 to 60 years old. So here the awareness on preventing breast cancer. First, maintain a healthy weight according to your body shape and exercise regularly. For example, decreasing your consumption of oily food such as fast food, fried chicken, especially the wing and skin. Exercising regularly is by exercising a minimum of 3 times a week. Some examples of simple exercise that you can do are brisk walking and jogging. And this is important to keep the mind, body and soul positive. Alright. Second, always practice breast self-examination. This is recommended to be done regularly at the end of your period cycle. You can Google the step on how to perform the examination, but the main goal is to identify any sudden change and to go visit your nearby doctor to address your concern. Lastly, if you have a family history of breast cancer or inherited change in your breast cancer A1 or breast cancer A2 gene, talk to your doctor about other ways to lower your risk. In example, if you feel that you are of high risk, make a frequent appointment to the doctor to have a breast cancer screening and mammogram test performed. Alright? In conclusion, as with most cancer, the earlier breast cancer is detected and diagnosed, the better chance of successful treatment. One of the best way of ensuring that breast cancer is for you to be breast aware. There is understanding and knowing how your breast look and feel under circumstances, so that you able to seek early medical advice if there are any chance in either breast. Alright. And also find out as much as you can about the subject so you can make an informed choice about treatment opinion. Just about treatment opinion. Do not be afraid to ask questions from medical practitioners. Be positive and lead a normal life after a breast cancer treatment. Take a good care of your mind, body and soul. So that's it from me. Thank you for watching and see you again in the next activity. Bye bye.